Hello, and welcome to this public service announcement on transformational leadership. I'm Kizzy, a certified nurse midwife, and I'd like to encourage you to truly think about the kind of leader you are and what you could become. Leadership styles are important because whether you see yourself as a leader or not in your life, it is likely that someone sees you as their leader or role model. Could be your children, your patients, your siblings, the neighborhood kids, or maybe a close friend that just can't seem to get her life together. What do your actions, attitudes, and motivations say about you? I hope the knowledge and insight that this PSA brings to you truly transforms the way you lead others. Transformational leadership is a leadership that changes and transforms people into using emotions, values, ethics, and long-term goals. This form of leadership puts as much focus on the characteristics of its followers as its leaders. It's often compared to and differentiated from transactional leadership, charisma, and authentic leadership. In the transformational leadership, followers and leaders are inextricably bound and cannot be separated. This leader-follower interaction raises motivation, morality, and accomplishment in both parties. Through many years of research, the factors of the model became known as the 4 I's. First, idealized influence or charisma, in its two parts. 1, the attributes of the leader as perceived by the followers, and second, the behaviors seen by the followers. This showcases the role model behaviors of the leader and is the emotional component. The second I is inspirational motivation. This is the ability of the leader to communicate high expectations and to create a team spirit environment. The third is intellectual stimulation. This component encourages and pushes followers to be creative and innovative. The leader cultivates problem solving and encourages followers to challenge their own beliefs and the beliefs of their leader. The fourth and final I is individualized considerations. This final factor is a supportive, listening environment that benefits both the leader and the follower. When implemented, the 4 I's will lead to staff performance greater than expectations and increased job satisfaction. Through the years, many people have used and researched the topic of leadership and transformational leaders. The term transformational leadership was first coined by James Downton in 1973, but the approach was made by James McGregor Burns in 1978. Burns' research and work was to attempt to link the roles of leadership with followership. He emphasized intrinsic motivation and follower development and the importance to inspire and empower others. His conclusion was that the followers' needs should be assessed, and through transformational leadership, followers can be motivated to a higher level of morality and have the ability to accomplish more than they expected. In the mid-1980s, Bass provided a more expanded definition that focused even more on followers rather than leaders. He combined the work of Burns and said the theory of the charismatic leadership done by House in 1976, and he suggested a form of leadership that didn't always have to be positive. From his work, he concluded that followers could be motivated to transcend their own self-interest for the sake of a team and the organization. Boss's work eventually led to the 4 I's model that is now widely accepted, and also a style of pseudo-transformational leadership in which the leader's interests are not for the good of others, but power-oriented and self-consumed. Since Bass, Coos and Posner developed their model of transformational leadership by interviewing over 1,300 leaders in middle and senior level positions about their leadership. Their research led to a 5-model practice. 1, model the way. 2, inspire through a shared vision. 3, enable others to act through building trust, utilizing teamwork, and promoting collaboration. 4, challenge the process and be willing to change. And 5, encourage the heart by rewarding accomplishments. So what does the evidence say? The evidence actually has a lot to say about transformational leadership and its importance across many organizations. Northouse states that it is the most popular approach to leadership and has been the focus of much research since the early 1980s. In an analysis of articles published in Leadership Quarterly from 1990 and 2000, a third of the articles were about transformational or charismatic leadership. Evidence shows that the characteristics and the qualities of transformational leadership can be translated into many successful organizations, including healthcare, corporations, education, management, and psychology. In 2007, a German study of public transportation employees found that transformational leadership improved employee performance and a company profit when used with characteristics of transactional leadership. Another 2007 study, Neumann and Keller, examined 447 employees at a multinational firm and found that the 4 I's positively related to job satisfaction and performance of their staff. In 2011, a Netherlands study revealed that employees became more engaged when their supervisors were able to boost employees' optimism through transformational leadership. 2018, Brevard and Baker studied the relationship between transformational leadership and employee work engagement among school teachers. They concluded that leadership behaviors fluctuate from day to day, and transformational leadership skills serve to sustain engagement during times of high job challenges and demands, and it protects engagement on days full of job hindrances. However, in both the research evidence and Nordhaus text, it is controversial whether or not transformational leadership is a trait that is intrinsic to a person or if it's a set of characteristics that can be taught and nurtured over time. Nordhaus states that this is one of the criticisms of this style because it is possible that not all people can utilize the style of leadership in their workplace. Fisher concludes that transformational leadership is a set of teachable competencies that improve nursing care. D.D. Warwick states that learning to be a transformational leader is an ongoing process filled with opportunities for new insights. He states that there are characteristics that can be taught and nurtured during the process, and it's a development of process. Warwick's research on the effects of transformational leadership on an organization states that there are 6 characteristics that give rise to leaders that encourage innovation and creativity, and they empower and engage employees and improves employee motivation. He states that this motivation leads to high morale throughout the organization and increased productivity. The research showed that transformational leaders create a vision and build trust that leads to growth and better performance of both the individual and the organization. Warwick's research also correlates transformational leadership with decreased employee stress and burnout. The combination of the above leads to a supportive, people-oriented environment. Warwick concluded that the most successful organizations focus on both leaders and performance. They do this by hiring leaders and training employees to be leaders. The training should focus on these 6 characteristics for success. 1, creation of a clear vision. 2, set a trustworthy example. 3, effectively involve others in establishing and completing goals. 4, demonstrate genuine concern for others. 5, inspire others to do their best. And 6, encourage innovation. His final statement of his paper is that the evidence in this article is to encourage organizations to invest in training transformational leaders and investing in the key concepts. The evidence also provides guidance to use in the clinical setting. Research by Boema, Spence Lashinger, Wong, and Clark in 2018 states that transformational leadership is a behavior-based approach to obtain performance beyond basic expectations of workers and to strive for excellence, and is key to creating supportive work environments in which nurses are empowered to provide optimal patient care. Their research points out that transformational leadership styles seem particularly relevant in the current turbulent and stressful healthcare work environments, and as most adverse patient outcomes are linked to poor work environments. Therefore, an improvement in these work environments should lead to better patient outcomes. They state that transformational leadership is consistently linked to better attitudes and behaviors in nursing and better job satisfaction. Leaders in healthcare have the ability to build trust of their followers, inspire others to act, create an environment of shared vision and shared decision-making, which is key to great healthcare, and mentor others, especially new nurses, into reaching their full potential. Transformational leaders encourage employees to participate in the decision-making process, which fosters critical thinking and the development of skills and knowledge, all key factors in a clinical setting and those that promote better patient outcomes. The use of transformational leadership in the clinical setting creates a structural empowerment that provides information, support, resources, and opportunities Research shows that this structural empowerment is associated with higher levels of nurse autonomy, control, and better relations with physicians. Boehme, Spence, Laschinger, Wong, and Clark concluded by stating that transformational leaders can have the strongest impact on nurses and patient outcomes when they use inspirational motivation, empowerment, and they encourage evidence-based practice. In an article, Transformational Leadership in Nursing, a Concept Analysis by Fisher, she states that as nurses, we have a growing responsibility for expansion of practice that requires strong and effective leadership skills. An understanding of transformational leadership will benefit the skill development and the practice. Nursing leaders are positioned to become more prominent players in healthcare reform and policy development, and our use of transformational leadership skills in the clinical setting can improve our healthcare team performance and clinical patient outcomes. As an example, I give you Adolf Hitler, who exhibited the characteristics of a pseudo-transformational leader. He obviously lacked the upstanding ethics and morals, but he was a very charismatic leader. When Hitler took office, it was a time when Germany was in discord. Unemployment was high, farming was failing, therefore the food supply was low, crime and hate were increasing. Hitler came in with a clear vision of where Germany could become, and his first address to the country was to encourage them. He had a plan to improve farming and lower unemployment through reformation camps, later known as concentration camps when the truth came out. Hitler used his political position to convince the public of his clear vision that criminals and unemployed could come and learn a trade and become productive individuals when secretly serving his own agenda under this ruse. It wasn't until later that people realized that the camps actually tortured and performed cruel medical experiments on the political prisoners and other people Hitler deemed unsuited for his ideal population. As we see from history, he truly transformed Germany and its people, but not in the way that raised morality or accomplishment. Mary Breckinridge is known as the founder of American Nurse Midwifery, a pioneer for rural nursing services, and established the Frontier Nursing Service, now known as Frontier Nursing University. She is a great example of a transformational leader in the clinical setting. Because of her family's political status, she was well educated and had the opportunity to study in the U.S. and in Europe. Miss Breckinridge's influence on followers stemmed from her exceptional drive to learn how to serve the healthcare needs of others and to use her time, money, and skills to bring healthcare to those who do not have access. She modeled the importance of continuing education, which is vital in healthcare. Based on the needs of the world at the time, she studied nursing in New York. She taught hygiene in schools. She worked in public health in Washington, D.C. She then traveled to Europe to work in public health in France, traveling to many rural villages, giving nursing services, eventually learning the art of midwifery and bringing it back to rural Kentucky and the United States. Mrs. Breckinridge showed her leadership skills by doing what was needed to be done and encouraging others to get educated by the best and join in her vision to bring healthcare to those who had no access. Miss Breckinridge modeled what she taught and inspired those around her. She has left behind an impressive legacy of healthcare that is still taught today. So what kind of leader will you be? I believe that transformational leadership skills can be taught, refined, and polished, but the approach only works when we are willing and able to step out of our comfort zone and become role models for those around us. We must have a clear vision that pulls in followers and energizes them to want to be the best that they can be. We must provide an environment that empowers, nurtures, and is based on trust and collaboration. In order to be an effective transformational leader, we must recognize and celebrate our strengths and accomplishments. We must acknowledge and learn from our weaknesses. In our day-to-day lives, our actions are seen by others. Will you choose to use your position as an APRN to build others up and to transform lives and organizations like Mary Breckinridge, or tear others down and create hurt and chaos like Adolf Hitler? I leave you with 2 questions to ponder. Have you ever used your influence or leadership position and skills to lead others into something that was not of the highest morals, but your intention started off good? And second, are you using your skills and charisma to make a change, or sitting back and letting others lead? If so, why? Our world needs great leaders to transform our culture into one of evidence-based healthcare, love, kindness, and understanding, chances are someone is counting on your ability to lead them, so please lead them well. And thank you.